Hi, I'm Dr. Mayank. I'm a board-certified plastic surgeon and diplomat of American Board of Hair Restoration Surgery, practicing hair restoration in New Delhi for the past 12 years. Today we are going to discuss a very interesting case of hair restoration where a 36-year-old gentleman was being affected by the kind of hair loss that is visible to us from the front and had started thinning in the crown as well. The patient had a history of baldness, which was genetic and had advanced grades of baldness running in the family. After having tried the medications to conserve what he had, he still wanted to redefine the kind of hairline and restore what he had lost over years. This was affecting his basic self-confidence, and he wanted that once it can be corrected, I would want to do that. So let's discuss what exactly was happening for him. He is basically at a grade 3 male pattern baldness, which is progressing towards a grade 4, as we are seeing from the front appearance itself. This is the oblique view. We can see that he has lost the definition of the hairline. There are some sparse follicles which are still there. Again, the top view, we can see that there is some thinning of the crown happening here as well, but there were no gross gaps here. So we did not choose to transplant this, rather just use medicines and PRP to kind of thicken up this area. This is the top view of the front profile where you can see the kind of loss that he had experienced. Initially, the plan was to mark the donor and do an FUT procedure for him, but since he's a professional who did not want the visibility of the stitches for the initial few weeks, which he was informed during the consultation but he did not register it, so we changed the plan and moved to an FUE procedure where we implanted the entire front appearance as well as the forelock area of the gentleman. You can see the kind of irregularities that have been given into the hairline to make it look absolutely natural. This is the oblique view. You can see the kind of densities that have been implanted, so it has been a relatively high density transplantation. To our surprise, when we see people with this kind of baldness, the number of grafts or follicles that is usually suggested for such people is extensive. Just for your knowledge, this is just 1,568 grafts that have been implanted with FUE, amounting to 4,200 odd follicles to cover the same area. When we look at the donor area, we have still conserved the lower entire part of his donor. The core follicles of the FUE have been taken from above the zone of the part from where we can harvest further another FUT if his baldness advances. The right side of his donor area is still virgin for the future as well. This is the look of the person after the bandage opening at 48 hours. You can see some amount of clots, some amount of deposits that are there, but we normally do not see swelling in the patients whom we operate, as we don't like to inflate the patient's scalp. You can again see that the crown at the time of bandage opening is also still visible, but we have not implanted anything into this area because on folliscopic analysis, we could see that there is extensive amount of thinning which can still be recovered with medications and PRP. That's the front profile. That's the look after 1 month of the transplant. This is the phase where you would see maximum shedding happening, but as you see, you would not notice much of the shedding happening in the patients whom we operate because the extraction and the implantation difference what we keep is very minimalistic. That's the oblique view. That's the left oblique view of the same gentleman. That's the look after 3 months. So that's the phase when the growth actually starts. After 2.5 to 3 months, you would see some amount of thickness coming in the same area, and you would see it would be asynchronous. Some parts would grow slightly faster, some would be slower. So as you see that there is some gaps which are still visible, which will take some time to cover up. As we proceed towards 5 to 6 months time zone, you would see that the gaps would get better. This is the appearance of the top view just at 3 months after the surgery. That's the look after 6 months. So this is approximately 85 to 90% of the result density that you're already seeing on the scalp of the patient as the left and the right oblique views. That's the top view density. Now just have a look at the crown area as well, which was not transplanted. but has recovered just with PRP and medications in that area. So when we look at a person who's undergoing a hair transplant, it is just like a blank canvas. We can decide and do things so that we plan for the future as well. I could have comfortably gone with a higher density than this, but what we require is not just high density. We want an optimal coverage where the visibility of the scalp is not there, and we should have adequate preserve of the donor, which we could utilize later in life when the grade of baldness increases. So I would personally like to request all of you to always let the decision be taken by the professional who's doing your procedure to decide what is going to be the best for you. Do not go to just Google and try to research what would be done for someone else may not hold true for you. Try to identify clinics which do all the techniques of hair transplant so that it becomes like a transparent decision. After having that discussion with the doctor, you can take that call, what exactly suits all the relevant concerns what you have for your future. I would like to thank all of you for sparing your time to view our video, and also would request you to please like and share this so that anyone who's in need for a hair transplant would get the correct transparent knowledge. And if you're interested in such informative videos or case studies in the future, you can put that in the comment box about what you wish to know. And if you have further concerns, you can contact the number given below. Thank you.